So I know what you're thinking. Is this girl seriously about to do a video with her face looking like this? Well, guess what? I am. We'll get to that in a second. So, it's been a little over 6 months that I've been doing the pelvic floor physical therapy, and I wasn't really seeing the results that I wanted to see. Things weren't getting worse necessarily, but they were like more maintaining than anything. And so my physical therapist and I decided that maybe it would be time for a referral to a surgeon. So we were able to, she was actually able to call somebody while I was there. And the doctor actually called like right back, because I'm in this pelvic floor chronic pain clinic thing for endometriosis. And so then they actually just did it all like right then. And so I was able to make an appointment with the surgeon. But I did go to that appointment as well, and that went pretty well. She approved me for excision surgery. They're going to actually do a hysterectomy and hopefully take everything with the exception of my ovaries. I really would prefer to just be able to at least keep one, if not both. I mean, as long as they're healthy, because I'm not really interested in like hormone replacement therapy and stuff like that. I think my body is hormonal enough, having enough issues with that. So I'd rather just be without anything. So we did that, and then she wanted to do an MRI before my surgery, because she's concerned that there might be some involvement with one of my kidneys and my GI tract at some point in there, and so she wants to be able to be prepared to call in any other specialists that she might need to do. So I guess we'll see how that goes. So that was just a little quick update about my current status. And then I wanted to talk about this, because you know, this amazingness that is going on right here with this face. To me, like the top three things, the top three worst parts about endometriosis: pain, obviously pain is number one, but tied for second and third would be the skin issues and the abdominal bloating. Like, those are the two things that just defeat me the most, because they're external. They're what you're showing the world. They're what everybody sees. Like, your face is the first thing that everybody sees, and my face looks wrecked. Like, let's call a spade a spade. My face looks wrecked, and my face has been like this for years. I have tried absolutely everything. I've tried like your cheapest stuff. I tried the most expensive stuff. Like, we're talking hundreds and hundreds of dollars worth of skincare stuff, and nothing works for more than like 2 or 3 days. And that is super frustrating. I went so far as to go to a dermatologist, and they did all the usual, you know, prescription antibiotics, and try this medication and try this medication. And I actually went full on and did Accutane. Accutane. Oh, I love you, Accutane. Amazing. It was beautiful. It worked perfectly for weeks and weeks and weeks and weeks and weeks. My skin had never been better in my life. My hair was shiny and beautiful, and everything was amazing. And that lasted me for probably a good 2 years. Like, I had a good 2-year run on that. But you can't take it forever. So now we're back to this. And this is just one of those things that I don't know that people necessarily directly relate it to their endometriosis, number one. And number two, not everybody really wants to talk about it. But one of the reasons that I do is because I'm not the kind of person that wears a lot of makeup in general. Like, typically, if I do wear anything, it's going to be like a tinted moisturizer. And a tinted moisturizer is not going to cover this. If you wear more makeup, I guess it's probably easier to cover. I'm not experienced with makeup. I don't enjoy wearing it. It's just not my thing. So I feel like I'm kind of stuck. And then the other thing is, like, the more makeup you wear, depending on the quality of it, I suppose, like, the worse your skin can tend to be, again, depending on the quality. Because, you know, if you enjoy wearing makeup and that's where you invest your money and stuff, that's great. That's not my skill, not my skill set, and I envy that, most definitely. But I just feel like a lot of people don't like to talk about it because some people see it as something that you can easily cover. Some people don't even assimilate that with being an endometriosis symptom, and then other people just prefer not to talk about it because here I am well past puberty and it looks like that just hit like last week. So it's pretty frustrating. I don't know, it's what you put forward, that's what the world sees first, and I just think that is really frustrating. And then I think some days I'm like, well, that's really dumb to complain about my skin, of all things, like of all the havoc that is going on in my body right now, like all of the pain and the swelling and the scar tissue and the damage that is being done internally, and I'm complaining about my skin. And I just have to remind myself that, like, this is probably like an external representation of what exactly is going on in my uterus right now. Because I've noticed, like, when my skin gets particularly horrible like it is right now, that kind of matches up with more of like the worst pain days. And I don't know if that's like in my head or if that's just what it is, but my theory is that those two are correlated, and maybe I'm just making it so. I don't really know. But anyway, so I just thought I'd give a quick update, nice little rundown. So my surgery is scheduled for about 7 weeks from now, so hopefully I will be able to update soon. And yeah, if this is what your face looks like, you're not alone, and it's okay to not be happy about it. You don't have to be happy about it, that's what happens. So, but I hope you all find relief, and take care.